So today, I think that true success in dentistry is measured in the longevity of each case you treat, the happiness it generates for yourself and your team, and not in each euro you make. That shouldn't be the primary goal. And today, if you think about it, it's not just the happiness and money. It's also about today. I think that true success. There was a little bit of a kickback there. The happiness it generates for yourself and your team. Hello? Each euro. Hugo? And today, if you think about it, it's not just... I'm getting a loop there on the sound. Are you getting that?
Yeah. And now? Is okay?
Yeah, now seems to be okay.
Okay,
so
okay.
Now one of the measures that is very important is the safety. Safety, and we're going to get into that. So if you think about it a little bit, in dentistry, we've got all of this technology, these techniques, new softwares. And again, if your audience don't know, at my clinic, we have pretty much every single advanced digital technology on earth right now. We're very advanced practice, but has dentistry really changed? The core values of dentistry, have they really, really changed? I don't really think so. So let's get into it. Why do people come to the dentist in the first place? They can come for a checkup, emergency pain, cosmetics, ortho, missing teeth, accidents, second opinion, so on and so forth. A whole and various multiples of this, right? At the end of the day, nobody wants to come to the dentist to fix their teeth. What they want is a nice smile. They want to be healthy. They want to be chewing. And that's what dentistry is. But the truth is that we never know who's going to come through the door. We know less about our consumers, about our clients or our patients than we do about our Uber driver. So a patient that jumps into an Uber to come to the clinic will know more about the driver than he knows about the dentist that's going to treat him. The only thing that patients are looking for now is if their insurance covers it. We have done a terrible job at explaining to humanity the right questions to ask their doctors. This is how it works today. Hello, can you fix my painful tooth? Yeah. How much do you accept my insurance? They're not going to ask you, do you have this technology or that material? How much time are you going to take? What, you know, they don't even ask that question. And if you think about it, the array of people that can come into our clinic it's astounding. You can have young, old, male, female, calm, nervous, opens the mouth well, doesn't open the mouth well, hygienic, dirty, insurance, no insurance, polite, rude, easy person, difficult person, healthy person, sick person, lots of time, no time, lives far away, lives close by because it changes a lot, mentally stable, highly unstable, no treatments ever or lots of treatments, and so on and so forth. Poor, rich, and every single combination of that. And we're supposed to be prepared for that. Now, as you know, dentistry has one of the highest mental illness situations. It's a quiet, not many people talk about this. My friend Simon Chard in the UK, he's the scientific chairman of the British Academy of Cosmetic Dentistry, is very open about this. My friend Kyle Stanley from Beverly Hills, leading surgeon in artificial intelligence in the US, is very open about this. But stress and mental illness is a huge problem in dentistry today. Why? Because we have a very difficult job. We have to make a lot of critical decisions, but it all adds up to something which I'll explain in a bit. Because as dentists, we are trained to do medical and dental diagnostics, restorative, endo, implants, ortho, you know. But what is asked of us, what really makes our job difficult, is the emotional side of it and the financial side. So we're trained to do clinical dentistry, but we're asked to run small businesses. And even if we don't own our own businesses, we have to manage our time. We have to manage our patients' emotions. They don't trust us. They, you know, especially imagine somebody, Hugo, I'm sure you know, people that have done a lot of, if you're doing re-endo, is a lot harder than endo because I had that done before and it didn't work, right? So, and then on top of it, all of the financial difficulties that patients have around the world. So what we're not trained to do, which takes up most of our spare time, is management, negotiations, marketing, human resources, financing, all of these complicated things that take up a lot of our time. And if you think about it, lawyers get paid to think and to present reports. They don't produce anything physical. All they do is mental. We're lawyers of the mouth. We have to negotiate between science and the latest evidence and all of this technology and the money and the cost, and we have to do this critical analytical thinking in a second. And expect patients to be happy with it, expect our bosses to be happy with it, our partners to be happy with it. And we have to go home as a human being, lie down and feel comfortable about that. Because we're all trained to do clinical work. That's what we're trained to do, clinical work. That's the only thing we're trained to do. I know very few dentists that have an MBA, very few on the planet. So 2/3 of our job, we're not trained to deal with. Moreover, we've got this incredible, complicated wheel of patients that can come into us for an amount of different things that is, there's no other medical profession in the world that has this variation. An eye doctor doesn't have this variation. A heart surgeon doesn't have this variation. Oh, but let's shut down all the dental clinics during the COVID virus. Let's not think dentistry is important. You're not a doctor, you're just a dentist. It's crazy. I don't see dentists, if Portuguese dentists, Spanish dentists, Italian dentists, any dentist from any country, instead of fighting each other, come together and fight the governments and the financial institutions that don't allow you the amount of time to properly do your job. Now, what do patients want from us? No pain, be punctual, don't take too many x-rays, don't make any mistakes. I want perfect aesthetics. I'm sure any dentist watching this has seen a patient come in, their mouth is destroyed. You spend months fixing it. And then at the end, you go to the mirror, ta-da, and they're like, oh, but look at this little angle here. And now this is not an A3. And you're like, woman, 3 months ago, you had no teeth. Shut up. You get angry. It's very frustrating. And make me happy. Do it fast. Do it cheap. Maybe could you put this on the insurance form? I don't work with insurance. Let's be clear. I never have in my career. And everything has to last forever. What's the guarantee on this? So they don't want to pay a lot of money. They don't want to sit a lot of time in the chair. And they're like, oh, but if you don't do a good job, I'm going to go to your competition. So most patients are actually acutely aware of 10 clinics in a 1 kilometer radius, and they use that to blackmail you. And let's just be very honest here. If that's not causing stress and anxiety in our job, I don't see how anybody can not agree with that. What don't patients care about? The science we study hard for, how difficult it is to make the correct diagnosis, how much our training costs, how hard it is to prepare for treatment. I don't know about you, but before I go into any treatment, I talk to my team. I talk to my assistants. I make sure all the necessary material is in the room, that it's properly disinfected, that I have stock, I have backup. For every implant I place, I have to have 5 in backup in case I drop it on the floor, or I need a bigger one, a larger one, a smaller one. That's very, very important. They don't care how much the technology costs, that you're probably not going to take a holiday this year with your family because you've invested in an intraoral scanner or something like that. How much the lab work costs, what type of materials you use, who pays for failure when it goes wrong, how much managing a clinic costs, and why you take longer to do the right thing. Why? Because we simply have never managed to explain to humanity that doing the right thing takes a little bit more time. Moreover, if you are an inexperienced young dentist, when the pressure load is higher and you want to do the right thing, you're just out of university and you're given a shit salary and 25 minutes to do it in, who's going to speak for these people? I'm going to speak for these people. People on Slow Dentistry, there's more and more people standing up for this. It has to end because we failed to explain to civilization that doing the right thing requires a lot of investment, a lot of time, a lot of passion, a lot of ethics. But what do we stupidly do? Everything they ask for, not what they need, but what they want. Why? Oh, I don't want to lose this money. I don't want them to go to the competition. And that's blackmail. It is. It's a financial blackmail. If you don't do this, I'm going to go next door. You know what I do? I go, can I give you the address? Because unwanted patients can cost you thousands of euros a year, every single one of them. And in order for you to understand if this patient can be a problem or not, what's the one thing that costs no money whatsoever that you have to do? Talk to them. Not sit down and start working straight away. I've been practicing dentistry for 22 years. I've run private clinics for 20 years. We never, ever, ever start a treatment in the first appointment, except for emergency pain therapy. And then the only thing we do is we stop bleeding, stop whatever, stop the pain, stop, and then we talk. And we talk, and we talk, and we talk, and we take CBCTs, and we take x-rays. And I want to understand, is this patient going to be a problem for me or not? Do they respect the value of my work and not just its cost? And that takes time. And when do you find that out? In a valid consent form, when you sit and tell the patient the risks and rewards of the job. So how can we stop and also protect ourselves against unwanted patients? We have to filter better, and we have to talk more, and we have to slow down. All right? So if you actually want to talk about the economy of this, you'll probably make more money in a decade by seeing fewer patients. Even if you charge the same money you're charging today. Why? Because the retention